Hello everyone, today we're discussing the flu. Everything about it. We're entering flu season, so we're going to talk about awareness and prevention. Why flu education matters in healthcare. Why flu education matters in healthcare? The flu is not just a bad cold. It is more than that. They are very different and are caused by different viruses. It can lead to serious complications like pneumonia, sepsis, and even death. Caregivers, sitters, CNAs, UAPs are often the first line of defense in spotting symptoms and preventing the spread of flu. So education ensures you know how to protect yourself and to protect your patients. That's why early recognition is the key. So I like starting off with our region. So we're going to talk about the importance for Louisiana, specifically the Acadiana area. So Louisiana consistently sees high flu activity during the peak season, which is the time between December and February. In the Acadiana region, factors like lower vaccination rates, higher rates of chronic illnesses, and multi-generational households that put more people at risk. Many patients cared for in this region are elderly or medically fragile. Those particular groups are more likely to develop complications. So did you know? So the flu causes up to 41 million illnesses and over 500,000 hospitalizations each year in the US. Specifically in Louisiana, flu-related hospitalizations often rise above the national average during that peak season or that bad season. People can spread flu 24 hours before the symptoms even start. Now we're going to go in what is the flu. Influenza, which we shorten it to the flu, is a viral respiratory illness. It affects the nose, your throat, lungs, but can also cause complications like throughout your whole body. So unlike the common cold, the flu usually comes on suddenly and very intensely. It spreads quickly in crowds like nursing homes, which we call extended facilities now, schools, hospitals, and even in your homes. So for instance, if you wake up feeling perfectly fine in the morning, but by lunchtime you suddenly have fever, chills, and body aches, that's more likely flu than a cold. Some of the signs and symptoms. So you may experience fever, chills, cough, sore throat, runny nose, may have muscle aches, body pains, headaches, fatigue, weakness. In children, sometimes vomiting, diarrhea. So some of the red flags that you want to look out for, that you want to report immediately, would be like trouble breathing, chest pain, any type of discoloration like bluish lips, confusion, dizziness. If you notice someone is unresponsive, severe dehydration, if you're not able to even urinate, extreme weakness, worsening of the chronic health conditions. So think of the flu as a spectrum. It can look mild in one patient, but life-threatening in another. So always take those symptoms seriously. So how the flu is spread? So the flu is spread through respiratory droplets from coughing, sneezing, or even talking. It can spread by touching contaminated surfaces and then touching like your mouth, your nose, your eyes. I always say if you're out in the public or anywhere for that matter, if you can try avoiding to touch your face, anywhere in your face, that's your best option. Always keep you some sanitizer. Even when you're out in the stores, wipe those baskets down. You never know what people are doing, coughing, and then they're putting their hands directly on the refrigerator, the handles of the shopping cart. So you just never know. Flu virus can survive up to 48 hours on hard surfaces, and people are contagious one day before symptoms appear and up to 5 to 7 days after. So this is why a patient can walk into a facility feeling okay, but by the next day, half the staff and residents are sick. Let's go over some of the high risk groups. So the adult populations of 65 plus. The immune system seems to be compromised or a bit weaker. Children under 5, especially under 2. Pregnant women, they're at higher risk for complication. Chronic illness patients, patients that have asthma, diabetes, heart disease, weakened immune systems. For these groups, the flu isn't just uncomfortable, it can mean hospitalization or worse. That's why prevention is key. And since we mentioned pregnancy, because we know that they can have higher complications. During pregnancy, a woman's immune system, the heart, lungs, they work harder. So this makes it easier to catch infections and harder to fight them off. So the flu can increase the risk of severe illness, hospitalization, and even premature labor or stillbirth. Some of the complications for the mother: higher risk for pneumonia, severe dehydration, or even worsening of existing conditions like asthma or diabetes. And even complications for the baby, like premature birth, low birth rate, rare but serious, pregnancy loss. We don't wish that on anyone, but these are some complications that are, that can happen. So prevention and protection for those pregnant moms. The flu vaccine is safe during pregnancy and recommended at any trimester. It protects both mother and baby. The antibodies do pass to the baby, offering protection for the first few months of life. So pregnant women should seek medical care immediately if they develop flu symptoms. Pregnancy doesn't just put, one life at risk, both the mother and the baby. So this makes early recognition and prevention even more important. Now we're moving on to prevention overall. So the best practices would be, of course, wash your hands. Wash your hands often, 20 seconds with soap and water. Cover your sneezes and coughs with tissue or elbow. Avoid touching face after touching surfaces. You want to make sure you clean, disinfect doorknobs, phones, remote controls, any type of shared items. Use a mask in outbreak situations. You would be surprised at the amount of germs. If everyone had to carry around a black light, you would be surprised the amount of germs that we encounter and the surfaces that those germs are on. When you're talking about remote controls, you're going into hotels. I hope you are wiping down everything. I hope you're sanitizing, spraying everything. You never know what those things in those hotel rooms have been through. Doorknobs, make sure you're wiping those down. Phones, all sorts of things that are germs that are lurking on those things. The flu vaccine is recommended yearly for most people over 6 months. You cannot get the flu. Okay? The flu vaccine cannot give you the flu. Okay? And we're going to go a little bit into detail about that in the next slide because I think that's very important. But prevention also helps reduce severity even if you still catch it. And this slide here is just it's just showing you the different flu options that's available. This one is the flu mist, which is not an option or the preferred choice for everyone. This is a needleless option where they shoot like this little disperse this mist in through your nose. There is no needle on it, but it's not the ideal option for everyone. There are some complications, and the people that have asthma or severe allergies, this is not the best option for them. So for the people that just absolutely cannot do needles, this would be an option for them. But unfortunately, everyone can't do the flu mist. But this is an option for some people. So you have the vaccine here, and then you have the flu mist. Now, it's been a while since it's been years since I have seen flu vaccine, in a vial that you had to draw up. It's been a couple of years since I've seen that. I think that is still available, but for the most part, the ones that I have been using or working with have been the ones like you see here with the green or the blue strip, the Fluval quadrivalent or the Fluorix. They are in pre-filled syringes. They are single dose, so it's only a dose for you, 0.5 milliliters. And it's not bad. I know everybody doesn't like needles, but I prefer to just give me the injection. So let's jump into why people think you can get the flu from the vaccine. Some people feel tired, you might feel achy or develop like mild fever after the shot. These are normal immune responses. It is not the flu. It's your body building protection. The timing also plays a role. So if someone catches a flu or cold right before or after their vaccine, they may mistakenly blame the shot. So let's go a little bit into the science. So the flu shot uses an inactivated, which means if it's inactivated, it's dead, it's killed already. So it uses an inactivated virus or a piece of the flu virus. It cannot cause infection. The nasal spray vaccine uses a weakened form of the virus that is too weak to cause the flu in healthy people. Now, what you might feel after the vaccine, you might feel soreness at the injection site, low-grade fever, fatigue, headache. And why this matters, the flu vaccine doesn't just protect you. They reduce the spread to vulnerable patients like children, elderly, and pregnant women. Even if you do get the flu after vaccination, it's usually milder or shorter. The flu vaccine, again, cannot give you the flu. What it can give you is protection, peace of mind, and the ability to protect the patients and loved ones you care for. Now let's talk about treatment and care. Most patients recover at home with rest and fluids. Fever reducers like acetaminophen, which is Tylenol, ibuprofen, some antivirals like Tamiflu, Xofluza, which is best if started within 48 hours of the symptoms. Keep the patient hydrated, monitor the temperature, and encourage rest. Rest is the most important thing. Report worsening or any new symptoms immediately. If you notice that a patient is not drinking or urinating or seems more confused than usual, that could signal dehydration or complications. And the responsibilities of the caregiver. Watch for early symptoms of the flu. Report any red flag symptoms quickly. You want to encourage prevention habits like hand washing, cleaning. Provide comfort measures like fluids, positioning, monitoring fever, and protect yourself. Use your PPE if recommended. Stay home if sick. As caregivers, you are the eyes and the ears of healthcare. Your awareness can save a life. So we're going to just do a little quick recap, and I hope you are paying attention because you will be tested on this information. This is mentioned in here twice for a reason. So, flu activity in Louisiana peaks December to February. December to February. That's like the very, very highest peak in Louisiana. In Acadiana, flu hospitalizations have doubled in severe years compared to the U.S. average. What that means is that more people in Acadiana are ending up in the hospital with the flu than other parts of the country, especially during bad flu season. So, for example, if the U.S. average is 20 people hospitalized per 100,000 residents, Acadiana might see 40 people per 100,000 in that same season. So this shows that our community is hit harder, more severe cases, more complications, and more strain on hospitals. And again, why does this happen in Acadiana? Because of lower vaccination rates, which means fewer people are protected, higher rates of chronic illnesses like diabetes, asthma, heart disease, multi-generational households, like flu spreads quickly between kids, parents, grandparents. Our healthcare access issues in some rural areas, people delay treatment, making the illness worse. So when we say flu hospitalizations have doubled in Acadiana, it means our community is more vulnerable. Caregivers like you are critical in breaking that cycle by spotting the flu early, encouraging prevention, and protecting high-risk patients. Now, let's go to test your knowledge. So the first scenario, a patient has sudden fever, chills, and a cough. What do you do? Patient has sudden fever, chills, and cough. What do you do? You're going to report the symptoms immediately to the nurse or the healthcare provider. Good job. Scenario 2. This is true or false. The flu shot can give you the flu. What's your answer? If you answer false, good job. If you answer true, shame on you. Scenario 3. Who is most at risk? 25-year-old healthy adult, 3-year-old child, or 70-year-old grandparent? The answer will be both. The child and the grandparent are at high risk. So in closing, the flu is common but can be deadly. Your role in prevention, early recognition, and reporting saves lives. Remember, prevention, hand washing, vaccines, clean environment. Awareness will be spotting symptoms early. And then we have to take action. We're going to report and support the patients. So as caregivers and sitters, you are the true healthcare heroes. Staying alert protects both your patients and your community. So until next time, I hope you enjoyed this training and you have a wonderful day.